In this video, I'm going to talk to you about nodules, specifically if you've got them, what can you do about them? Because it does cause a lot of panic in people, and it's not just singers and performers who get nodules. Anyone can get nodules really, but they tend to happen specifically to people who use their voice more than others. And not just using their voice more, but using their voice in a way that the voice eventually gets a bit tired of and starts to have a reaction to. So there are lots of factors that go into nodule formation. They come over time. They're not an instant thing. And so usually a person's had a pattern of using the voice, and sometimes we call it a bit of a misuse pattern, sometimes an abuse, a vocal abuse pattern. But basically, vocal cords are two muscles that can be slightly overused in the wrong way. And doing that for too long, too often, is going to get people into trouble. Now, in my experience, some people are prone to nodules a lot more than others. There are many people like me who use my voice a lot and don't tend to get nodules. But I think understanding a little bit about the voice mechanism and how it works keeps me safe. But most people don't have that background. So if they're straining their voice or pushing their voice in the wrong way, they don't know that they're doing it. They may have a history though, and you might be one of these people who says, oh, every time I go to a party, the next day I lose my voice, or I lose my voice for a couple of days. So there's often a history that the voice pattern that hasn't been that healthy or helpful has been there for a long time. Sometimes it happens in noisy families. So if everybody's quite loud, people sometimes raise their voice a lot and competing for a little bit of attention. That's sometimes a factor environmentally. Personality can also be a factor. Sometimes for extrovert people who use the voice quite loudly or perhaps quite forcefully, and without realizing it, with a little bit of constriction in the larynx, a bit of a push on the vocal cords. And nodules is classed as a bit of a vocal overdoing condition. So it's people who overdo something, and it's usually overdoing the way the muscles are used, not just overdoing the amount that you talk. So if I start talking with quite a constricted pattern like this, I do this more than about 10 minutes or an hour or 2 days, eventually my voice is going to get unhappy because it's being a little bit too squeezed from the larynx. I've lost all the forward placement that's important for a voice, and specifically the little laryngeal squeeze, and you can have a squeeze coming in from the side of the larynx or from front to back, depending. That will cause the vocal cords to just bang together a little bit too much or to rub together a bit too forcefully. And what happens when there's pressure on something or something rubbing together too much, a bit like if you're wearing a tight shoe, a corn will develop or a little swelling will develop or a little blister or something will develop. And that's due to the friction, really, too much contact or too hard contact for too long. We can all take a little bit, but not for too long. Nodules are bilateral, which means they're on both of the vocal cords, and they're little things usually. They can get bigger, and sometimes if somebody gets a cold or more inflammation on the vocal cords, they'll get quite puffy. And over time, with the right kind of treatment, we hope to reduce the size and actually to eliminate them, because the main way we get rid of nodules now is actually by therapy. It's not by surgery. Surgery is reserved for very extreme cases where all else has failed. But why the treatment switched to therapy as the mainstay and not surgery, as it was in the very old days, is because they found that when they did surgery on people, the nodules just returned. And they just returned because it's a behavioural condition. It's caused by people's behaviour, usually unknowing behaviour, but it's behaviour nevertheless. So part of the therapy is to get the awareness going about the voice, how it's being used currently, and how a healthier pattern can be established. Their exercises can be quite illuminating quite quickly, really. There's a lot you hear on the internet about voice care or from many other sources, and your therapist will often spend time talking about voice care. But actually that can be covered very quickly. Things like keeping hydrated and not shouting too much and things like that, and maybe some anti-reflux advice. But those factors alone will not usually reduce swellings. It's usually behavioural aspects that need to be tackled. And that's a very personal thing according to everybody's lifestyle and their individual vocal needs. Establishing good techniques, removing some of the tightness here, balancing the resonance more, and then eventually when the voice is nice and smooth and the quality is clearer, so it's not husky. Typically, nodule voice will sound quite husky and breathy. And then after that, to then be able to improve the stamina so that you can use the new technique voice for longer and then also louder. So all the vocal demands that are made upon us nowadays, because we don't all just have one voice. Sometimes places are noisy. Sometimes we have to call out. So the later stages of therapy will tackle that type of thing to make sure the voice is remediated, that it's got a good technique going forward, and that the nodules don't come back. Because what we do know is if nodules are left untreated, and even if they go away by themselves, because often people are told to rest and they rest for ages, and oh look, they go to the ENT and the voice looks better. But when they go back to voicing again, go back to work, go back to using their voice like they used to, very often the nodules will come back because the vocal patterns have not really been altered enough in a way that will stop the nodules coming back. So I hope that's been helpful. And if you did find the video helpful, don't forget to press the like button and subscribe to the channel.